Quick note. This is an automated educational summary of public medical sources: Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you've seen inflammation flagged on a lab report or heard a doctor mention it, you've probably wondered, what does it actually mean? Is it serious? And how much does testing cost? Today, we're breaking down everything about inflammation blood tests, including real costs, how they work, how to order online without a doctor visit, and how to understand your results. By the end, you'll know exactly what you're paying for and why. According to Mayo Clinic, inflammation is your body's response to injury or infection. It's not inherently bad. Acute inflammation is actually how your body heals. The problem surfaces when inflammation becomes chronic, persisting for months or years. The NIH research suggests that chronic inflammation markers in blood can be measured, and these measurements help indicate a person's inflammatory state. Think of it as a snapshot of what's happening internally, not a diagnosis on its own. Elevated markers don't mean you're sick. They're just data. Doctors typically order inflammation markers when patients report persistent fatigue, unexplained joint pain, or digestive issues. MedlinePlus notes that inflammatory markers are also tracked in people managing autoimmune conditions, monitoring heart disease risk, or responding to certain treatments. Some doctors include them in general health screenings. These tests don't diagnose disease. Instead, they provide data helping clinicians assess trends and decide on next steps. It's one piece of a much bigger picture. The most common markers are CRP, C-reactive protein, and ESR, which measures how quickly red blood cells settle in a tube. According to the Cleveland Clinic, CRP is produced by your liver in response to inflammation. ESR indirectly reflects inflammation level. The CDC also references high-sensitivity CRP for cardiovascular screening. The test itself is a standard blood draw. No fasting required. Results come back in a few days. Some labs offer 24-hour turnaround. You'll receive numbers with reference ranges showing what's normal. With insurance, inflammation tests usually cost $50 to $200 out of pocket, depending on your deductible. Without insurance, expect $100 to $300 per marker at traditional labs. Online lab companies undercut this significantly. CRP tests run $75 to $150. Multi-marker panels, $200 to $400. The advantage is transparent, upfront pricing, no insurance hassles, no hidden facility markups. You pay once, get results online, then decide your next step. Services like Everlywell and Let's Get Checked handle these daily at predictable prices. Blood tests require an order from a licensed provider in most U.S. states. You can't self-order. But telehealth and direct-to-consumer lab services partner with physicians who'll issue orders. You fill out a health questionnaire about symptoms. A provider reviews it within hours and issues a digital order. You visit a local lab partner for the blood draw, then wait for online results. No video appointment. No formal office visit. Costs are transparent. The provider's order is required, but the process is quick. When results arrive, you'll see numbers and reference ranges. MedlinePlus and Mayo Clinic both publish typical CRP ranges. Under 3.0 mg/L is normal. 3.0 to 10.0 mg/L is mild elevation. Above 10.0 mg/L suggests significant inflammation. ESR ranges depend on age and sex, but the Cleveland Clinic outlines them clearly. Here's critical. A high number isn't a diagnosis. It's data. Discuss results with a clinician who can interpret context. You can't from numbers alone. A single result on its own means very little. Once you have results, options depend on your situation. Some people make lifestyle changes, reduce processed food, increase movement, manage stress. Others consult their doctor about underlying conditions. Some monitor response to ongoing treatment. The key: tests give you information to act on. Don't assume one elevated result is dire. Trends and context matter far more. If this is your first test, order again in a few months. That pattern tells you far more than a single data point ever could. To recap, inflammation tests are simple, affordable online, and provide data worth discussing with your clinician. You now know what they measure, what they cost, and how to order without a formal office visit. If this was helpful, like and subscribe for more health education. Check the description for trusted resources. And here's our question for you. What type of health tests are you interested in? Comment below and we will make a video about it.